Hello, everyone. The pressing health issue that my group and I have chose is folic acid deficiency in Hispanic American women. This is completed by Group 14. As for the issue at hand, folic acid deficiency, the reason that we chose this issue is because Hispanic American women are particularly vulnerable to developing a folic acid deficiency during pregnancy, which is detrimental towards the newborn child. They get conditions such as neural tube defects and spina bifida, and essentially these are lifelong debilitating conditions that not only impact the person's quality of life, but also their education and how they will live for the rest of their life. Now, why we chose Hispanic women in particular is because a lot of these women don't get folic acid in their food. They need what is called fortified food. So fortified corn tortillas is when they add the folic acid into the tortilla. And we chose the population because it highlights critical, relatively newfound disparity. This is very new. They've done research, I want to say in 2020 to onward, and we want to raise awareness and improve maternal outcomes for this.
This article discusses the impact of voluntary folate fortification of corn masa flour on U.S. pregnancies. It was found that neural tube defects, or NTDs, continue to be the highest among Hispanic newborns before and after folic acid fortification policies were released in the United States in 1988. Voluntary fortification of corn masa flour products was approved by the FDA in 2016 to address this issue. However, no significant reduction in NTDs was found in predominantly Hispanic zip codes. Hispanic mothers were found to be around twice as likely to have children with NTDs compared to white women. This concerning trend has prompted additional research to be conducted on this topic in the hopes of informing future public policy, health advocacy, and education. Mandatory fortification for corn masa flour products is projected to provide a more robust reduction in occurrence of NTDs for Hispanic women, rather than simply having voluntary fortification. These changes are essential for widespread maternal and community health and will help to reduce the burden of neural tube defects.
Multivitamin use among Hispanic women of reproductive age in the United States. This was a study done in 2024 by the Journal of Women's Health. In this study, they talk about how the mean total folic acid intake was lower among Mexican American women who only speak Spanish rather than Mexican American women who speak English, only English. This shows the effects around acculturation and how the diets differ, especially involving foods that are primarily corn mesa, as those lack folic acid. The recommendations for folic acid intake is about 400 micrograms for women capable of becoming pregnant. With this recommended amount, women will have a 70% reduction in birth defects like anencephaly and spina bifida. There has been a decrease in daily multivitamin taking among all women of reproductive age, especially among the Hispanic women population, which is the most important to take multivitamins, as folic acid in their diet is a little less than others. Multivitamins are also a great source of many other vitamins to keep the baby healthy.
A notable example of recent press coverage is Latinas deserve the same healthy pregnancies as other moms. It highlights a formal citizen petition filed with the FDA to mandate bilingual warning labels on corn masa products that lack folic acid, following the failure of voluntary fortification efforts since 2016. Despite the FDA's 2016 approval for voluntary fortification, the health equity gap remains wide. Recent data shows that as of 2022, 0% of corn tortillas and only 14% of corn masa flours were fortified. This directly impacts the Latino community, as Latinas are 19 to 20% more likely to have a pregnancy affected by a neural tube defect compared to non-Hispanic white women. The article focuses on the fact that while wheat-based staples like bread and pasta have been mandated for fortification since 1998, corn masa, which is a primary cultural staple for over half of Hispanic women of reproductive age, was excluded, and this exclusion creates a systemic barrier where the food supply itself fails to provide the same level of protection to Latino families as it does to others. So the focus of current advocacy has shifted from voluntary to mandatory information. The petition argues that bilingual warning labels of English and Spanish are necessary to inform consumers that a lack of folic acid increases the risk of serious birth defects. This strategy aims to empower shoppers to make informed choices while simultaneously incentivizing manufacturers to finally begin fortifying their products to avoid the label.
The main barriers this population faces is the lack of culturally appropriate information in healthcare and the language barriers they face. Many Hispanic women, particularly those who only speak Spanish or have certain cultural beliefs, may not fully understand the importance of folic acid as a vitamin, especially before and during pregnancy when it's most important, and therefore may also not understand the impacts it has on themselves and on their babies. This was discussed in Chapter 3, the section on cultural approaches to health, which shows how culture shapes health beliefs, communication, and access to care. This chapter explains that health behaviors are strongly influenced by cultural norms, and that disparities often arise when health messaging does not align with a community's cultural context. Therefore, a resource when addressing this health disparity for this particular population is public assistance programs such as WIC. It could be a potential resource because it is already an existent program that is tailored to assist Hispanic populations in providing food assistance, education on nutrition, and prenatal guidance. In addition, another educational resource is the Promotora de Salud model, which uses medical workers and community members to spread awareness and culturally tailored education. This would allow this population and these women to receive nutritional knowledge and therefore understand the importance of the intake of certain vitamins like folic acid, and therefore it will result in an improved vitamin intake. Actually, as a result, there has already been statistically significant evidence in overall awareness of folic acid intake, and therefore has also resulted in an increase in the overall multivitamin intake amongst this population.